An explosion of cases. That's how healthcare workers describe this sudden spike in illnesses, flooding urgent cares and emergency rooms right here in Tulsa. 2 News Oklahoma's Kathy Tatum reveals what's making us sick.
RSV, flu, some COVID.
St. Francis crunched some numbers for us and found over the past month, and especially in recent days, it's experiencing what it calls an explosion of patients with respiratory and gastrointestinal illnesses. But on the bright side, only about half of what it saw this time last year.
As far as the GI stuff, lots and lots of kind of viral bugs.
I checked the state's flu tracker. Oklahoma's overall positivity rate for influenza-like illnesses is 15%, with Northeast Oklahoma lower than the western part of the state. But doctors tell me over the next month or more, many of us will come down with respiratory and stomach bugs. That big uptick in numbers has emergency rooms filling up along with the waiting rooms in urgent cares. But there is a way you can cut the wait.
Virtual visits are great. If you're not having shortness of breath or really high fever.
The last thing you want to do is have to go sit around and wait when you're not feeling well.
So Lynn Casey used her phone for a virtual visit when her son came down with strep throat.
The whole process between waiting for the video visit, getting to the lab, having it done, it was over within an hour.
We can talk about it, and sometimes we can get an answer just from that discussion. Within the Warren Clinic St. Francis system, we can also order testing where you can go to the nearest lab, walk right up to the lab, get swabbed, and you'll have those answers without having to go and sit in the doctor's office.
And Dr. Meissen says don't put off getting checked if you suspect you're coming down with COVID or flu. Medications for those need to be started quickly to be effective. In Tulsa, I'm Kathy Tatum, 2 News Oklahoma.